Two of the most common valve surgeries you'll hear about are the aortic valve, which sits at the base of your aorta, which is the main aorta that leaves your heart, and your mitral valve, which sits in between your atrium and your ventricle. Those are the two most common valves you'll hear. You have also your tricuspid valve and your pulmonic valve. But I think what happened with the aortic valve, most people have 3 leaflets. And so if you look right at it, it looks like a Mercedes symbol. And so as you get older, some people build up calcium that clogs the valve up. And so what'll happen is, as the valve starts, the leaflets don't open as well as they should, you get what we call aortic valve stenosis. The heart has to work extra hard, having to push the blood through that valve that's not opening the way it should. And when it gets to a certain point, you can measure the pressures across the valve and the area that it's closed up to. And when it gets to a certain point, or the patient becomes symptomatic from it as well, we do recommend replacing the valve. You typically don't repair the aortic valve. You'll also see some people are born, in fact it's one of the most common congenital anomalies, is that people are born with 2 leaflets, and that a lot of times later on in life causes trouble because it tends to clog up sooner. And so a lot of times you'll have people that have to have them replaced. Another thing that can happen with your aortic valve is it doesn't close the way it should. It's stuck open. That's called aortic valve regurgitation.
The aortic valve is probably the most common valve that requires replacement, both because it fails to open and because it fails to close. Most valve replacements today are done surgically. There are newer technologies, there are non-surgical valve replacement technologies, primarily for the aortic valve. Nobody wants to have open heart surgery, honestly, because it's an invasive procedure. And most people would rather have their aortic valve replaced through a non-surgical means if it was possible. The problem is that these non-surgical therapies are not fully proven yet, and they're only FDA approved for high-risk, inoperable, high-risk, and moderate-risk patients. 80% of patients are low risk, and they don't qualify for the non-surgical valve. And those people, a minimally invasive aortic valve replacement really is the option for them, the only option for them.